You are watching the DocTalk show.
Cancers of the blood, or also known as leukemias, are the most common type of cancer in children. So we want to understand more about these leukemias. Why do they present in children? Why is it the leading cause of cancers presenting in children? And with me in the studio is our senior oncologist, a pediatric oncologist, to help us understand more about leukemias. So Dr. Joyce, leukemias, or what they call blood of the cancer.
Cancer of the blood.
Sorry, yes, cancer of the blood. What exactly goes wrong in this disease? What is it all about?
Leukemia is cancer of the blood, as you have just said, and that means that something goes wrong in a mother cell that forms blood. And the mother cell is obviously found in the factory in terms of using an analogy. The factory of the blood cells. So the factory of the blood cells is in the bone marrow. For those of you who don't know the bone marrow, if you've eaten chicken bones before, when you break the chicken bone, that red substance in the middle,
Inside the bone.
inside the bone,
It's called the bone
that's
marrow.
the bone marrow. And that's where the factory of the blood cells lives in people.
It's where the blood is produced.
It's where the blood is produced.
From the bone marrow.
Yeah. And in there are mother cells that give rise to the different types of cells. There are three main types of cells that perform different functions. Okay, and I'm sure we've all heard a lot about some of these functions in different capacities. We've heard about the cells that fight infections. We've heard about the cells that help us to carry oxygen, that make the blood red. We've heard about the cells that help us to prevent us from bleeding excessively. Those are called platelets. All these are very important cells for us. So in leukemia, something goes wrong with the mother cell, so that these cells, most especially the white blood cells, start to misbehave, as it were, and to reproduce uncontrollably and fill up all the space in the factory so that the other types of cells have no space, literally. And that is why these white blood cells, their numbers go up, and then the other cells that transport oxygen, the hemoglobin, and the other cells go down. And that is why these children present the way they present when they come to the clinics. They'll present with requiring of blood transfusions. They are very pale. And one of these is because they don't have enough of the red blood cells. Why? Because the red blood cells are not being formed enough. There's no space for them in the bone marrow. And so these children will typically present to us saying, my child has been transfused many, many times in this hospital, and every time the blood keeps getting finished.
Keeps getting finished. And often the children will always be tired. They're not able to play.
And then they're tired.
Or they have difficulty walking. Or they even have sometimes labored breathing.
Exactly.
So those are some of the signs to indicate that the blood is very little.
The blood level is low. Because remember, it carries oxygen. And oxygen is necessary for you to do all these exertional things, for you to feel energetic. Okay, so if you have low hemoglobin, you feel fatigued, like he's saying. You feel tired, breathless. And so the children won't play the way they should play. And then the other type of cell I talked about was the platelets, which help you to stop bleeding when you get a cut. So ordinarily, when you cut yourself with a knife, within seconds, the bleeding stops. When you have a tooth taken out, like your child goes to the dentist, or at home, for example, and one of the milk teeth falls out, within minutes,
the bleeding
stops. But these are children who are going to present to you with, I took my child to the dentist, they took out the tooth, and for 3 days, the gum is oozing. Okay? Or they'll present to you with spots under the skin, meaning that they're bleeding under the skin, or purplish, blackish marks under the skin, or bruises, or very minimal trauma. Knocked herself on the table, and suddenly a black mark appeared at the place where the child knocked himself. So this is because the platelets, those blood cells that are supposed to help you to prevent excessive bleeding, are also low. And low because not enough of them are being formed, because the other white blood cells are taking up all the space in the factory, and there's no space for these other types of cells. And so those are the three cardinal ways in which children present who have leukemia. They keep getting pale and requiring blood transfusions. They bleed easily in an abnormal way, and then recurrent infections.
Those are the main signs to watch out for. That would indicate the child might be having
Yes,
a leukemia.
and
Just how aggressive are these cancers?
Yeah. So acute leukemias are very aggressive. In terms of the progression, we're talking about weeks. We're talking about days to weeks in terms of evolution. So that's the other problem I get, a question I get from parents. They worry a lot about, did I do something wrong? Did I not come in time? Perhaps I did this. It is not possible for you to have it for 10 months. Sorry, it's something that you have for days to weeks, so maybe 2 months.
So it means
Evolution. It's a
within that
very
period of time,
rapid
it's
evolution.
rapidly getting worse.
Yeah, it's a very rapid and very aggressive disease, and if you don't do anything about it within the 1-2 months that the child that is evolving, then you can actually have death quickly. And that's why it is important for parents to know about this, for doctors to suspect this when parents take their children to the doctor, so that it quickly, suspicion, investigate this. If you see a problem, refer the child to the nearest cancer treatment center.
So you mentioned acute. That means there could also be another variety, what they would call
Yes.
the chronic.
Yes.
Are they also that aggressive as the acute type?
No, chronic leukemias are not as aggressive as acute leukemias. In fact, those ones evolve over a longer period of time. But they are not very common in children.
They're
We
not
do
so
see them,
common.
but they are very uncommon. They are more common in the adults.
So the big thing to worry about are the acute
And the
leukemias.
acute leukemias, yes.
Okay, so after the break, we shall come back and understand whether these acute leukemias are treatable. Okay, because you mentioned they are so aggressive within a few months. They can start from a simple illness that becomes worse and worse and might end in death. So I want to know, are these leukemias treatable? And better still, how can we prevent, if there are any ways of preventing children from getting these leukemias? You can send your questions and comments on the social media platforms, Facebook, Twitter, and also log on to our YouTube page, that's the DocTalk Show, and you can continue watching some of the videos that we upload there.
You are watching the DocTalk Show.